Are you interested in becoming a respiratory therapist? FCC offers a 67-credit Respiratory Care Associate of Applied Science degree to prepare you for this exciting healthcare career. On our website, frederick.edu, under Respiratory Care, you will find detailed information about the Respiratory Care program. This information includes program requirements, the curriculum pathway, job outlook, and median salary information for respiratory care therapists, and much more. Go to frederick.edu, Respiratory Care, when you have a moment and check it out. What do respiratory therapists do? Take note of the careeronestop.org video link where you can watch a short video that explains the typical work of a respiratory therapist. What do respiratory therapists do? The profession is called respiratory care because RTs do more than just therapy. Respiratory therapists educate, assess, and evaluate patients' respiratory function, operate breathing machines, ventilators for babies, children, and adults, administer oxygen, perform CPR, provide pulmonary function testing and education. FCC's respiratory care program includes classroom instruction, respiratory skills lab training in patient assessment, operation of ventilators, skills and simulation labs, and practicum placements where you put all of this together in the care of real patients. Meeting FCC's respiratory care learning outcomes involves recommending and performing procedures to maintain the airway, remove secretions, and assure ventilation and tissue oxygenation, performing a full physical assessment and provide safe respiratory care by modifying therapy or making recommendations for changes in therapy based on the patient's response to their current therapeutic regimen, promoting disease prevention and wellness by educating patients on the proper use and care of respiratory equipment, providing care without discrimination on any basis with respect for the rights and dignity of all individuals, demonstrate behavior that reflects integrity, supports objectivity, and fosters trust in the respiratory care profession and its professionals as identified by employer survey. At the completion of the respiratory care program and upon earning the respiratory care AAS, graduates obtain the CRT and RRT professional credentials through examination in order to practice respiratory care. CRTs and RRTs participate as an active member of the American Association for Respiratory Care. Let's learn how you can apply to the respiratory care program at Frederick Community College. At FCC, respiratory care is one of several selective admissions programs. This means that students must first complete specific general education prerequisite courses and then apply for admission to the program. All courses must be completed with minimum grades of C. However, higher grades are recommended to be competitive for admission to this program. The respiratory care program has a limited number of seats and more applicants than there are seats available. Students are selected into the respiratory care program based on a point scale. The highest point total students are admitted to the program until available seats are filled. What are the general education prerequisite courses needed to apply to this program? To earn the respiratory care AAS degree, students must complete general education courses and, once admitted to the program, respiratory care courses. General education courses can be completed at FCC or another undergraduate institution. If completed at another undergraduate institution, they must transfer to FCC as the following: English composition, 3 credits, a general education math elective, 3 credits, general psychology, 3 credits, small group discussion or any Gen Ed Com elective and a cultural competence elective, anatomy and physiology 1, 4 credits with a lab, anatomy and physiology 2, 4 credits with a lab, microbiology, 4 credits with a lab, 1 to 3 credit PE health or nutrition elective. Please note, if taking Anatomy and Physiology 1 and/or Microbiology at FCC, students must complete a Gen Ed Math of Math 120 statistics or higher, and students must first complete a science prerequisite. Science prerequisite options are BSci 55, BSci 150, or Chem 101. Technically, applicants to the Respiratory Care program only need to complete Anatomy and Physiology 1 in order to gain admission to the Respiratory Care program. However, as you will see when we review the point scale, this likely will not be enough points to be selected into the program. Any general education requirements not completed prior to admission to the Respiratory Care program must be completed while progressing through the respiratory care classes, and all general education requirements must be completed to earn the Associate of Applied Science degree upon completion of the respiratory care courses. The respiratory care program has a once-a-year application deadline of June 1st. There are 25 available seats and typically around 50 applicants for these seats. The highest point total applicants are offered the available seats in the respiratory care program. Students can enroll in as many classes semester by semester as their lives and schedules allow, as long as they meet course prerequisites. We encourage students to not overload their schedules and to leave a little wiggle room for when you need more study time or something unforeseen happens in your life that impacts your studies. Here is a sample plan for a student who can accommodate 3 classes in their summer schedule and 4 classes in their fall and spring semesters. You can progress through these classes in a time frame that works for you. However, this is what we encourage you to do. If you're working full-time, enroll in 2 classes a semester, for example. Upon application to the program, points will be assessed to your application using this point scale. The maximum possible points is 15, and the top 25 highest point total applicants will be offered admission to the respiratory care program. Typically, the 25th seat is filled by a 12 or 13 point applicant. Once admitted to the respiratory care program, students progress through as a cohort over the 2 years of the program. There is no way to slow it down or speed it up. Students must complete the courses shown here during the semester shown and in this sequence. All respiratory care courses must be completed with minimum grades of C, and a C once in the program is 75% or higher. Please note that any clinical healthcare program is very challenging and requires a lot to be successful. They require a lot of mental and physical energy and time to study, time to prepare, time to practice, time for small study groups and to interact with your faculty, and time to rest and recover so you can stay sharp and not get overly stressed. As challenging as a selective admission healthcare program is to gain admission to, it turns out that getting in is the easy part. We hear this over and over again from clinical students. You want to set yourself up for success once you are admitted to a selective admission healthcare program. Do not overschedule yourself. Make sure you have adequate study time. Reach out to faculty and to classmates if you are struggling and need assistance. Make sure you have wiggle room in your schedule for when something unforeseen happens, and make sure you have a lot of support around you. Upon successful completion of the Respiratory Care program, you earn the Respiratory Care Associate of Applied Science degree, take the licensing exam to become a CRT or RRT, and start your respiratory therapy career. What are the overall steps to begin this journey? Apply to Frederick Community College. Have official transcripts from all undergraduate institutions attended sent to FCC for evaluation. If needed, complete needed placement testing in reading, writing, and/or math. Meet with an advisor to plan coursework and semesters and to enroll in classes. Contact us if you have questions. For your reference, here are links to FCC's admissions information for the college and respiratory therapy career and respiratory care program information. We hope you have found this information helpful.
Your academic advisor will depend on your last name. My name is Alia, and I advise healthcare students whose last name begins in A through K. Amber advises students whose last name begins in L through Z. We look forward to working with you.